how many of you suffer from headaches? Maybe not on a daily basis. Maybe some of you do. It's just a constant dull feeling. You're tired of taking medications. What do? Well, do what like Lexi did. Come see a chiropractor. How are you?
I'm well. How are you?
I'm doing very well. Thank you very much. Now, you said you've had headaches for pretty much most of your life. Tell us what that's like.
So most of the time it's migraines and they're debilitating. I have to go to a dark room, sleep it off. I haven't found a medication yet that had worked for me, so this seemed like a next natural progressive step to come see Dr. Spencer.
Did somebody recommend this, or just did you read up on it or something that a chiropractor could help you?
My mom, she's a patient here, and she saw it on the Shop South Mississippi, and came here.
Thanks,
and
Mom.
she yes, and she recommended me after seeing some of the posters and stuff around about coming in for migraines.
So you came in, and I guess Dr. Spencer diagnosed, as far as talked to you. Did a consult with you.
Oh, we did some x-rays and kind of came to the conclusion of where it was stemming from. And I will say, since I've been here, I've not had a single headache.
Really?
So, yes, and I was at least 2 times a week suffered from migraines. So I have not yet.
And
Fingers
like you
crossed.
said, it's pretty debilitating to have one of those.
It is.
Because, I mean, I've known people in the past, and they are. I mean, you were pretty much out of it. I mean, for forever. How long?
The only thing that worked for me was sitting in a dark room, and no one wants to spend their life like that, or their evening. So
no, not unless you're Batman or something like that, or that you can do that. But I guess with the X-rays, she found where you had the problems
and where it was stemming from, and where a lot of my attention was holding. So.
How old were you when you started? I mean, for all your life, you said.
I mean, since I can remember being a child, I would have stayed from school or stuff like that just from having headaches.
Wow. So well, I'm glad you're up and running again, full force.
I am
too.
With
no headache problems.
Yes.
All right.
I'm very grateful.
Thank you so much.
Thank you.
Let's talk to Dr. Spencer now and find out how you could probably get some relief if you or someone you love is suffering from migraine headaches. That is such an amazing story.
It is.
I mean, Lexi having headaches all of her life. And she looked relatively young still, so I wasn't going to ask her age. But do you see a lot of people that suffer from headache problems, especially migraines?
Yes, frequently. About 20% of our patients that come in here have some type of headache, whether it's migraine or tension type, that occurs on a regular basis, and sometimes people call them normal headaches. I have normal headaches. Well, headaches aren't normal. It's not a normal part of a daily lifestyle to have headaches, and people don't realize that because they're just used to putting up with them all the time.
And taking stuff for it all the time.
They don't realize how much medication they're taking for them every day and so forth, and that chiropractic can potentially help them with those headaches and make them go away. And some of the things that we can do to relieve those headaches and where they may be coming from may be their neck. And so that's what we begin with, is a thorough history on that patient and an examination to see what's causing their problem.
Now, I would think that a lot of it has to do, with, as you mentioned, tension headaches, pinched nerves, something like that in the neck or wherever. But it can actually go all the way up and down the spine.
Absolutely. Well, we begin really with looking at the neck and a person's lifestyle and their job and so forth. And so let me just talk to you about a few things that can cause headaches. Okay. All right. I'm going to use my little model here, Sammy the Spine. A lot of the headaches come from the upper cervical area. You have these delicate little nerves that come out on the side. And when the vertebra here misalign or twist, it can put pressure on these little nerves here. Well, these nerves come out and go into the brain and to the scalp, and they're actually controlling the diameter of the blood vessels. And when you're not getting good blood flow to the brain, it can cause some type of chemical reaction and cause a migraine. So one of the things we want to look at really closely is the alignment of these upper cervical bones to see if they're in their proper place and if some adjustments can relieve the nerve pressure here. Another thing that's really very common, Jim, is a forward head posture. I think we talked about this on a segment in the past, where a person is missing the normal curve in their neck and they're leaning forward because they have...
Remember you talking about that.
And for every 1 inch that the neck is forward like that, the muscles and your shoulders are having to work 10 times harder just to hold the head up.
Wow.
So, and a lot of people have 3 and 4 inches of the forward head posture. And this puts a tremendous amount of tension on the nerves that are coming through here, going up and into the neck and shoulder area, and can cause some constriction on these nerves and make a person have a tension headache. And this is chronic and recurring. And many times, Jim, people are in poor sleeping postures. They're sleeping on their stomach. They're sleeping with their head turned to the side like this. So just imagine the tension that this puts on the upper cervical area as a person is sleeping at night. And we need to get them sleeping on their side or on their back to have their spine in the proper position to support the way that their spine should be shaped and what should be occurring to them, because they're sleeping 8 hours.
And it's important to have the right pillow as well.
Absolutely. If you have a pillow that's making you have this forward head posture all night long, and you're waking up with a stiff neck and your joints aren't allowed to move properly, of course this can cause headaches as well. So one of the things we get the best results with is headaches. I love seeing patients like Lexi who've been having headaches all their life and seeing them respond well to chiropractic care without drugs, without surgery, without shots. So, a lot of people are having to get Botox injections and different things like that, and they've never even tried chiropractic.
Wow.
What I like to say is chiropractic first, drugs second, and surgery last. I mean, we certainly can't help everyone, but we have about an 85% success rate with headaches.
That's good.
Which is pretty good.
That is pretty darn good, 85%.
Yeah.
And I do want to mention real quick, even though you think you might sleep real good, there are those that, in office jobs, sitting at the desk all day long, they're sitting in front of that computer, and your neck's, you're like that. I'm guilty of it. I
Yes.
try to watch myself. I'm getting older, but not to sit there like that, and you can feel it crunching up in here.
Absolutely.
So.
Well, just look at how these nerves come up the back of your head,
You got about
Jeff,
40 seconds.
on the back of the head, and how they can be interfered with. So this is a very delicate area and one that requires some special attention, and we know just how to give it to patients and how to give them the care they need.
That's awesome. Thank you so much, Dr. Spencer.
You're welcome, Jim.
If you'd like some more information, you see the number on your screen. You'd like to make an appointment, you're suffering from headaches or know somebody that does, like Lexi, as bad as the migraines. You'd like to see about getting some relief, give Dr. Spencer a call. Get an appointment here with them. They're located on Pass Road in Gulfport, across from Pass Road Elementary, and see if they can help you out here at Spencer Chiropractic.